the Obama for President movement before I decided to run for president, R.T. Rybak, Mayor of Minneapolis. Mayor of the great city of St. Paul, Chris Coleman, is in the house. Your Attorney General, Lori Swanson. Your State Auditor, Rebecca Otto, is here. And one of the finest public servants in the country, my Secretary of Health and Human Services, Kathleen Sebelius. Yeah. The biggest Obama fan in the country is in the house. Michelle has a picture where she looks like Sasha next to this guy. She's a great supporter, and it's great to see you again. You know, I don't know if any of you caught it on television. You may have been watching So You Think You Can Dance. But Michelle loves that show. But the other night I gave a speech to Congress about health care. I have to say, I can already see that this crowd is a lot more fun. Just to speak to senators or representatives. I went to speak on behalf of the American people. You see, I ran for this office because I believed it was time for a government that once again made possible the dreams of middle-class Americans that were looking at for ordinary people. Struggles that you wrestle with at the kitchen table when you're going through all the bills, or when you're lying awake at night at the end of a long day and trying to figure out what you're going to do about health care for your children, what you're going to do about the situation with your mortgage, worrying about how stable your job is, what's happening with the economy, seniors who are worrying about their retirement security. You know, and I know, that health care is one of those fundamental struggles. Because if you're one of the tens of millions of Americans who have no health insurance, you live every day just one accident or illness away from bankruptcy. And contrary to some of the myths out there, these aren't primarily people who are deep in poverty. A lot of those folks are on Medicaid. These are people who are working every day. These are middle-class Americans. Maybe your employer doesn't offer coverage. Maybe you're self-employed and you can't afford it because it costs you 3 times more in the marketplace than it does for big companies. Maybe you're one of the millions of Americans who denied coverage because of a previous illness or condition. No fault of your own, but insurance decide it's too risky or too expensive for you to cover. In the last 12 months alone, 6 million more Americans lost their health insurance. 6 million more. Today we received more disturbing news. A new report from the Treasury Department found that nearly half of all Americans under 65 will lose their health coverage at some point over the next 10 years. Think about that. More than 1/3 will go without coverage for longer than 1 year. We got to do something. It could happen to anyone. But I don't mean to tell you that our healthcare problems don't stop with the uninsured. How many of you who have insurance have ever worried that you might lose it if you lost your jobs, or you changed jobs, or you had to move? How many stories have you heard about folks whose insurance company decide to drop their coverage or water it down when they get sick and need it the most? You know somebody who paid their premiums every month only to find out that their insurance company wouldn't cover the full cost of their care like they thought they would get. We've all heard these stories. There's the father I met in Colorado whose child was diagnosed with severe hemophilia the day after he was born. Now they had insurance, but there was a cap on their coverage, so once the child's medical bills began to pile up, the father was left to frantically search for another option or face tens of thousands of dollars in medical bills. Another woman from Texas was about to get a double mastectomy when her insurance company canceled her policy because they said she forgot to declare a case of acne. True story. By the time she had her insurance reinstated, her breast cancer had more than doubled in size. Small business people. I got a letter just this week from a small businessman. He said, I don't know what to do. I've always provided health insurance for my families, but here, the attached bill shows that the premiums have gone up 48% in the last year. And I think that I'm probably going to have to stop providing health insurance for my employees. I don't want to, but I don't have a choice. These stories are wrong. They are heartbreaking. Nobody should be treated that way in the United States of America. And that's why we're going to bring about change this week. Has now been nearly a century since Teddy Roosevelt first called for health reform. It's been attempted by nearly every president and Congress since. And our failure to get it done, year after year, decade after decade, it has placed a burden on families, on businesses, and on taxpayers, and we can't stand it any longer. We cannot sustain it any longer. Your premiums will continue to rise faster than your wages. If we do nothing, more businesses will close down. Fewer will be able to open in the first place. If we do nothing, we will eventually spend more on Medicare and Medicaid than every other government program combined. That's not an option for the United States of America. So Minnesota, I may not be the first president to take up the cause of health care reform, but I am determined to be the last. We are going to